Okay, good morning. Welcome to the Board of Health special meeting. It's 8 o'clock. We'll call this meeting to order. Today is a kind of a special meeting where we're basically just doing interviews, so we have no minutes to go over. The board remembers that we had at the last meeting, we had 3 new members that were sworn in. But since we've spoken with that was done the same process as the BOCC does with most advisory boards. However, the legal team has told us that we need to do a do-over. So basically that's what we're doing today, doing a do-over today. And next week, there's another interview with some more members. Furthermore, the tribal member, Alyssa Fine, who was with us up until the last meeting, she has resigned and she's moving on to a job position, she told me. So today is just the first of 2 meetings, just for dealing with the interviews. We have 3 people candidates that we're going to interview today. After the 2 interview meetings, the Board of Health will then take a vote on a recommendation of the 3 positions, the 3 candidates for 3 positions. That recommendation goes to the Board of Commissioners, and the Board of County Commissioners, not the Board of Health, would actually make the decision and their vote and the final appointments for the board. A standard set of questions was developed between the legal team and our clerk's office that was based on the WACs and RCWs. These questions were used on the applications. I don't know if I need to read through each question. No, but they are standard and they are on all the applications. The board can follow up with any other questions after that for each candidate.
I did get a question from a person over the weekend. Are these available to the public too? So they are on the website. Okay. Okay. All right. Thanks.
Okay. Anybody else have any comments before we start with the first candidate? All right, we'll jump right into it. Our first candidate for the Board of Health to the other stakeholders, other community stakeholders, is Lorna Stewart. Thank you for joining us this early morning.
Thank you. Thank you for having an alternate day that we could sign up for.
No problem. We try to accommodate. What did you think of the application process? How's that first question?
Oh, it was pretty straightforward, just on the website and fill out the questions and send it in. So very, very easy.
Okay,
yeah.
That's good. Well, I guess the interview process is kind of open. To start with whoever has first questions or would like to ask a question. Mary Jane?
Did we not get questions?
I
thought there was a prescribed list of questions.
Those are the ones that are on the application.
Will be same questions here? Oh, yeah.
So
Go ahead.
while you look at it, you mentioned in your application that you've done a lot of volunteering and in particular, the sentence I'm looking at is these diverse populations are all represented in Cowlitz County and have shown success in working with all these groups. Could you provide me an example?
An example of success?
And maybe if you have a failure too.
Yeah, so depending on which group, I guess you're talking about, success might be measured differently. In fact, I worked for 4.5 years with homeless youth and women involved in prostitution in the Seattle area. And success there sometimes is picking up a young lady on the side of the street and taking her out to coffee. So she's out of the rain and out of the out of the weather for a while and developing a relationship with her. It may not be she leaves that life at that moment, but or that lifestyle, but I would call that a success to build that relationship with her. On a more local level, more recently, I served for 7 years on the Cowlitz Soccer Association Executive Board. And I think one success we had there was during COVID, we were very innovative in still getting kids out on the soccer field. There were a lot of parameters that we had to keep in mind, some hoops we had to jump through, but we were still able to, we provided what we called Soccer Saturdays, where we had kids come in. We had, I think, 8 or 9 weeks that they could come and play, and we were able to follow the guidelines that we were given and still get kids out on the field and interacting with each other. So there's a couple successes
thank
maybe.
you.
So you talk about, one of the questions is describe your.
It's hard to, I can't hear you.
I'm a little slow.
That's okay.
Describe your commitment to public health. Can you talk about your commitment to public health? And also, can you tell me what your vision or what your definition of public health is?
Yeah, so my commitment to public health, I think first of all, it's been obvious. I've been at the meetings in the last number of years and tried to give input when I'm able. As far as my commitment to it, I think being involved in youth sports is one good measure of commitment. I mean, the kids need to be out. It's good for their physical health, their mental health, socially, all aspects of their life. So I was involved in that, like I said, for 7 years. My definition of public health, how to define it without using the term, right? I mean, it's the health of the local, whatever jurisdiction you're talking about. I think public health in this term of how the public is interacting with the government in regulations and guidelines that the government is giving that impact public health. You had something else. Did you say the vision? Wait, what was else? I'm sorry, I lost.
No, just your definition, your background in public health.
Okay, I hope I answered that.
Good morning. I now
Good
have a
morning.
name. I didn't know your name before this.
Oh,
You know, we never have people introduce themselves.
you
and,
know, I know. Well, now you have it.
You mentioned that you represent the business community,
Mhm.
but you don't list, you list that you have no connections with any business organizations at all on the back page. You have no other organizations that you're dealing with. So help us understand the local business experience that you have to represent
Yeah.
that type of a community stakeholder.
Yeah, I think that kind of to talk about the last page, when I answered that question, my interpretation of that question was businesses that impact public health. And so when I said no to that question, it was, I don't have a financial stake in any business that a regulation would be made from this board. So that was my interpretation of that question. As far as business owner, we own rentals. So that's my connection to the business world locally. Yeah, so that's our business. I'm not sure how much more you want besides that.
That's fine.
Is that good? Okay.
That's information that wasn't on
Yeah.
there. And you have attended a number of the public health meetings. To what extent should the Board of Health be making recommendations to the Board of Commissioners in terms of how we identify what the major priorities are for protecting public health?
Right. So to what extent should they be making? Not totally sure if I understand that. Like, I think the Board of Health should.
Actually, let me just rephrase.
Okay.
What are your priorities
Okay,
for
that's-
public health?
That's a good question. Okay. I think my highest public health priority right now is drug use and mental health as it impacts, especially the homeless population. I think that's a huge public health issue in this county. Maybe it's a little side note. The Longview Police did a presentation to the Longview City Council a couple of months ago. I can't remember if it was a regular meeting or maybe a special meeting. And I walked away for the first time really encouraged. I've been frustrated with the response to homelessness in this area. And I walked away really encouraged from that meeting. And so I would love to somehow have the Board of Health and the county be supporting the new direction that the Longview Police is going with their homeless response and how they're providing interventions for the homeless. So I think that's probably the biggest priority that I would say.
Thank you.
Yeah.
Following up on that question, the drug use, I believe also a big problem. I have been of the mind to educate and prevent children from doing it in the first place as a key to prevention of the future users. What do you think about focusing on that?
I think there's a piece that needs to be focused on that. I'm not totally sure what that should look like, to be honest. We had Joy Lyons from the ESD came and made that presentation. I don't remember if that was April or May or something. And I followed up with them and asked them for their statistics, comparing kids that have gone through their program and kids that haven't gone through their program. And I think we're on like 7 or 8 emails now, and they've forwarded me to a number of people. I still haven't gotten really like solid data from them that says, wow, the kids in our program do X and the kids who haven't gone our program do Y, and this is the difference we're making. So I would love to see some like really solid data on that. I think there does need to be an education piece. You know, she herself said that the what program did she mention? The This Is Your Brain on Drugs program. She said that actually ended up being more harmful than helpful. So I just want to make sure that whatever we're doing doesn't end up being more harmful than helpful. I mean, maybe what they're doing now is more harmful than helpful. I just don't know. The numbers just aren't there. So I do think education needs to be a part of it. I'm not sure what that looks like, to be honest. You know, do we give parents do we enable parents to educate? I mean, that's going to be the strongest advocate for any child is their parent and their family. Do we somehow strengthen families that give kids that support to not fall into that? I'm not totally sure what that looks like. But I'm willing to look into it more, but I was really hoping at one point in the emails that we sent back and forth, I said, I really want to be able to like say, this is a great program. Like, can you guys help me? And I haven't gotten that back yet. So anyway.
I appreciate your interest in just following up with Joy.
Yeah.
Because yes, there was a lot of questions, and that's so far this board has only seen that one group, their efforts.
Yeah. And I'll forward that to you. I was going to do that. They just, maybe it's been a week ago, sent me like a packet of, it was like an attachment to an email, a packet. And I haven't really even looked at it, honestly, thoroughly. I've super quickly perused it, but I'll forward to that so that the whole Board of Health can have it. I think that'd be useful for everybody to have.
Thank you.
Yeah.
Commissioner Dahl?
Yeah, I'll probably follow a little bit up on Dennis. Kind of get your ideas on what do you think the end product should be from the Board of Health? Is it programs that we all follow? Is it information and resources? Or is it some kind of combination? Where's the happy medium there?
Yeah, that's a good question. I would probably lean more towards information and resources. I think people need to be able to make their own decisions regarding their health, along with their physicians and their medical team. I think that needs to be the main decision-making body for an individual. There are some program types, like I said, if we can somehow support the homeless task force, or we can somehow support, the new direction that Longview Police is going, maybe that would look more program-ish. But I think as far as individuals, I think it needs to be, I don't think there should be mandates coming down. I don't think there should be things like that. I think it needs to be, here's the information, you take the information, go to your healthcare team, and together, that's where the decisions need to be made on personal health.
Any further questions from the board?
I A question, can you talk about what you're, what you view as the difference between personal health, like you going to your medical team and making a decision versus public health?
Yeah, so public health to me, I guess, like I was saying in the beginning, when you asked a definition of public health, is more policy wise as a governing body. So for instance, putting out information, putting out, you should wash your hands before you as a restaurant cook or whatever, those type of things versus personal health is things that just impact you as the person, like you need this medication. It shouldn't be mandated that you take this, you take blood pressure medication so you don't have a stroke while you're driving. That shouldn't be mandated, but you and your physician need to make that decision. Okay, I need blood pressure medication because my blood pressure is running high or whatever the situation could be. Did that answer sort of? Okay.
Thank you for that one too.
Most of the stuff, they've done a pretty good job of
Yeah.
answering out in here, so. I think, and we're kind of running, if we're holding to our 20 minutes, we're about there
Okay.
anyways.
Well, thank you very much.
Well, is there a question you would want to ask?
I was
any
gonna
of
ask.
us?
Oh,
It's not necessary, particularly if you intend to ask me a question.
wow. Not that I can think of off the top of my head. I feel like I've been to enough meetings. I have a pretty good sense of how it works. So, yeah, not that I can think of. Thank you though. So
Well, thank you for
Perfect.
your
absolutely.
time.
And
Thank
thank
you.
you. Thank you again.
Enjoy your trip. Be safe.
Thank you. We will. It'll be fun.
The next person we have, but I don't see this person here yet.
We got a couple minutes probably, but
Yeah, we got a couple minutes. Should we take a quick break?
we can.
How about
You can just recess it till the next person gets in.
yeah, okay, we'll take a short recess until the next candidate comes in. Are you Karen Joyner?
I am.
Oh, hello. Please have a seat. We're taking a quick break, but we'll be right back.
Okay, thank you.
And she's being held hostage back there.
Yeah, but it was a nice place to be held hostage. No complaints.
Want to start again? Okay, we're back at the Board of Health again, and we have our next candidate, Karen Joyner. Thank you for coming. We'll start again at the end, I suppose. Mr. Mortensen.
It's not necessary. We could do a shift by one and
Happy to go. Welcome and thank you for coming. Thank you for applying. Can you talk a little bit about in your application, you talk about page, your commitment to public health. Can you talk about the difference between public health and personal health and what your definition of public health is and how it might relate to our community?
Certainly. My background in nursing gives me some extensive experience with the difference between public health and personal health. Public health being looking at society and what's out there and what we can do to better society's health as a whole. So public health is concerned with sanitation, clean water, diseases that are infectious that might affect the public, versus personal health is more about how am I doing? How is my health? When you look at public health, you think about access to healthcare. What does the general populace have and need to maintain their health and encourage their health? Maybe it's education. There's an overlap between public health and personal health in that I, as a person, need to know what's going to help my health, but so does society in general. An example I can give is when COVID hit, and I was at the college in a dean position, and the meeting with everybody. We had a big meeting. I was running the meeting. I was serving as interim vice president of instruction. And what do we do in this big news, right? And at that point, what I chose to focus on in the meeting is, hey, this is new, this is scary, we don't know, but we can all practice good hygiene. And talked about hand hygiene. Wash your hands, be aware of where your hands are. Look around the room, how many of us are doing this? And so that was a great intermix of personal health and public health. You're welcome.
You mentioned in your application that you were raised in Montana. Whereabouts in Montana?
Missoula.
In
Of course,
Missoula.
the joke is if you go 50 miles out of Missoula, you're in Montana.
Yeah. Yeah, Missoula is a pretty big city. I just spent some vacation time in Big Fork, enjoying the musicals. So you've lived in this community for a while, obviously, and you've interacted with future nurses, obviously, in the community. How would you define your priorities for addressing public health needs in this community? What are they?
So I think public health needs always start, I like to go back to Maslow's hierarchy of needs. And, if you look at the bottom of his hierarchy, it's always about physiological, right? Food, water, sanitation. So we need to make sure we have those things, that base covered. Then we look up to the next level of safety and security. So I see public health needs for our community are addressing some of those basic, what's access to food, what's access to sanitation, how about our clean water, how about our basics? Do we have those covered and covered well? Then let's look to safety and security. Let's look at access to healthcare. Let's look at health disparities so that we can make sure that we are taking care of our most vulnerable members in our public area. So that's how I look at public health.
Okay.
Make sure those basics are covered.
Thanks.
I don't have a specific question right this second. Commissioner Dahl?
Probably just, what I would ask is, same thing I asked the others is, what do you see as the end product of, what do you think the end product of the Board of Health is? Is it programs? Is it information? Is it a combination? What do you think the end product should be?
Ooh, excellent question. I think the end product, and first of all, I want to say it was very hard for me in doing some prep for the meeting to find what the goals were
Yeah.
of this. I couldn't find them on the website. I tried a million different ways. So that's an excellent question. I think the end product of public health is ensuring public health. So to me, that means a lot of providing for the basics, making sure we have those basics met. It's education. It's not about control. It's more about ensuring that people have good, healthy choices and infrastructure in place.
Do you have any time commitments or anything that prevent you? We have monthly meetings, usually at 10 o'clock on the last Tuesday. Any kind of conflicts with
No.
that?
I can make myself available for that. On Tuesday mornings, many times I'm serving on a discipline committee for the state board, the nursing board, but that is flexible.
And are you okay to criticism? Because being on the board here, we get criticized quite a bit.
Well, serving as a dean and director of a nursing program, I am open and used to that.
Very good.
We did have YouTube can't put us in timeout for a
Yeah.
while.
YouTube jail.
Cracked me up.
So, so Karen, I really appreciate you applied.
Thank you.
I feel I could talk to you for hours, so I'll try to be very constrained here. The question that my colleague immediately to my left asked between public health and personal health is one that it's certainly one. The public health often will fall into trying to decide when my disease affects you, the general public. And I like the answer you gave, and I think we need to keep that in mind when we decide. So as a I've got to stop and make sure I'm asking a reasonable question. Tell me a little bit about your recollections of when opioids first became understood to be addictive.
Oh my, that's a great question. Having served in healthcare as a nurse practitioner since 1996, recently retired, it's been very interesting to watch the pendulum swing as far as pain control and how we control pain and what the problems are. I would say that we've always known there's a risk, always. I think it became more pronounced in probably the early 2000s. And that's where we were prescribing because we were trying so hard to treat pain. Pain was the sixth vital sign. You had to assess that on everybody. You had to make sure you treated it adequately. I also had experience in hospice where pain control is absolutely number one. So I think the pendulum, we got a little too overzealous in our prescribing.
Who was
And
we?
We meaning healthcare providers, and didn't realize the severe impact that was going to have. I did not realize the extensive marketing that was going on with OxyContin. You don't realize that when you're a healthcare provider because you see it as they're telling you this is the good thing, this is what you're supposed to do. And so it was about 2000 that I think we started having more awareness. 2010, that decade. I think it's been most pronounced since about 2018. And I believe that addiction, not just opioids, but alcohol addiction, all addiction issues are a number one public health concern. When we look at public health as managing the health of the population, and that is a huge effect on our population right now, particularly in the rural areas. Having been involved with many rural areas in Washington State through the Rural Outreach and Nursing Education Program that I helped get up and going from Lower Columbia College, I've been to Ferry County and saw firsthand that addiction was their number one issue, and that was alcohol. So addiction's huge. I hope that answered your question.
It did as best as I think anybody could. Like what I'm thinking right now is laudanum was known to be addictive back in the early 1900s. Alcohol has been known to be a problem since forever. And so whenever I see a discontinuity in history, I wonder exactly what stimulated this thing. It's beyond me some of the conclusions that OxyContin was less addictive than other stuff, and that's been used as an excuse, and we've penalized pharma. They've got plenty of blame. So your thoughts about the FDA, which came about, what, about 1953-ish?
Ooh, that's a very general question. Thoughts about the FDA? Can you refine that a little bit? Is there something specific?
There are treatments that are available in other countries that take a long time to be available here. And the question is when you're treating a patient who's maybe having real troubles and there's a potential cure that the FDA doesn't want you to use, that kind of thing.
You know, that's very difficult because I very much believe in evidence-based practice. And so we have to look at the evidence, and evidence can come in all directions, and you can have dirty data. So there's a lot to look at. Sometimes I think the FDA is overprotective on what they're going to allow in the states. I would say overprotective versus underprotective, because often there are treatments available in European countries that are not available here. I trust most European countries to have vetted what they are doing well. So I think sometimes the FDA is a little tight, but I understand that their job is, again, public health and to protect the populace. So they don't want to approve something that they are not sure of is safe.
Karen, you mentioned the pandemic, I think, as it having had an impact as you were finishing up your career, I think.
Yes.
What lessons have been learned from going through that whole experience? We don't have too many of those pandemics.
No,
So,
no.
It's a learning opportunity, and so what have we learned about?
I think that's an excellent question. It'd be wonderful to sit here and talk about that with you guys for a while. I think some of the important lessons are we didn't know what we were dealing with. And we have learned from that shutting down everything, shutting down the world and society caused irreparable harm to economy, to mental health, to education. There was just a lot of damage. We have also learned that our healthcare system can be overwhelmed pretty readily. And we learned how to mobilize additional resources when needed and where needed. Having seen some of the hospitals be overwhelmed, it was frightening, very frightening. I think some of the other lessons are how much should government intervene in individual health versus public health, and where are those lines? For example, I know that you guys instituted that, I'm sorry, I'm not going to get it named, or that the special document about medical
freedom resolution.
Yes, thank you. Thank you. And I think that was a lesson learned. You know, how much can we be imposed on us, what we should put in or on our bodies versus how much is freedom? I think that a lesson learned was basics, hand washing, cleanliness, keeping a distance from people, covering your cough. If you travel to Japan, for example, you will see people wearing masks all the time. That's just an accepted cultural norm there, that they wear a mask. And you don't know if they have a mask on because they're contagious or they're protecting themselves. Fabulous. So I think that was another lesson learned here, is that we need to allow our cultural norms to shift. If you want to wear a mask, wear a mask.
Thank you.
Any further questions? Okay.
Is she going to ask us?
Yeah, would you like to ask? Do you have any questions for us? Thank you, Dennis.
I do. Thank you. What are your priorities for public health as a board?
Well, it's an agenda topic. We are meeting with the HHS at the next regular meeting to kind of refine the priorities. If people would like to tell their individual priorities.
Yeah, if you look at the data, we spend more on public health than any other nation in the world, and we're not the number one in public health. Of course, those measures are a bit soft, but the dollars being spent and the slope of our success is not this way, it's this way. And so the question is always on my mind, are we part of the solution or are we actually part of the problem? You used the term evidence-based before, and I have a very strong science background and engineering, and I find it appalling what people call evidence. So I would like us to make more judicious decisions how we spend the money. And that requires a lot of data, and it's the devil to get real data.
Thank you.
Real quick, it feels to me like we're just ordinary citizens. We're not experts. And so I tend to have confidence in our Board of Health staff because those are the folks who are on the front lines. Those are the folks who are answering the phone calls and collaborating with the local care providers. And so I believe that they have a good read on what our community needs in terms of public health.
There's an interesting relationship between the state government and the state health boards and HCA and all that, and what we do at the local level. The state has their interesting formula on how much money is available for public health remedies, programs, treatments, whatever. We send hundreds of thousands of dollars back because we don't spend it. And part of that is we've never done a systematic data collection query in terms of what are the real health needs. We're really good at reading headlines. That doesn't necessarily identify the local health concerns. So we're operating at kind of an absence of data. I always get a little nervous when people say we need to use evidence-based practices because one size does not fit all. And what may be the evidence-based successes in downtown Seattle simply isn't apropos here in a much more rural setting. And so there's that, we need to have the information gathered locally, I think.
I agree, because you
and-
need to be able to compare apples and apples.
The result is we send hundreds of thousands of dollars back that the state says is available to us to solve problems. We haven't figured that out. We haven't figured out the problems yet.
But what a fun challenge to have money to
Should be.
spend. You just have to figure out the right, helpful ways to spend that.
My priority has been, well, my idea of a priority would be to focus on the youth. Our Healthy Youth Survey showed, I don't have it in front of me now, but it was close to 80% or something of the youth in Cowlitz County were experiencing some severe mental depression and problems. Then which leads to drugs, which leads to adult drug problems. I think the war on drugs hasn't really done a lot of good. I spent money since I was a little kid on projects like that. So I think targeting the kids just kind of as prevention, an ounce of prevention is worth a pound of cure is what I was taught. And so that's been my priority, trying to focus on the kids.
Yeah, I'm kind of somewhat along that line. I think you start with the kids and ensuring that they have good basics and they have the information they need to do the healthy things. On the other side, I differ with Commissioner Weber a little bit. I think I don't really need to study what's wrong with our county. I think drugs create a lot of things. It creates homelessness, it creates theft, it creates all kinds of things. So I'd be much more than studying that, getting into some viable things that could actually be done to help it. I don't ever believe you're ever going to cure drug abuse. It's going to be around. It has been forever. But I think we can find a better path than what we're on now. And sometimes those are hard questions, and a lot of times people don't want to get into the hard questions, but I think as a Board of Health, we need to touch those and not be afraid of criticism from outside if we do touch on those hard questions and some of those solutions. So I don't, if we're going to spend money, I want to see a result. And it's very simple that way. I'm not going to take somebody's money and just turn over and not give them anything. If we're going to spend money, I'm in the sense of, I'm in the vein of Commissioner Mortensen. If we're going to spend it, I want some results. And that's what I'm
and I-
looking for.
Yeah, and I think we owe that to the taxpayers. If we're going to spend their money, we
Absolutely.
need to have a result to show them.
Absolutely, yeah.
Thank you. There's a wonderful book on addiction in humans, and it's about addiction throughout the years and kind of biologically how that is set within us. And it's a great look at addiction. It's kind of scary, but
Yeah.
it's a challenge.
You get me on it, probably get me going down an aisle we don't need to go, but to me, we've made, if you look at it, two roads, you got the addiction road and you got clean road. We've made the addiction road so easy, there's no reason for somebody to get off that road and come over to the other. And I think we need to square that up.
The question is how, right?
Yep.
Thank you. What do you see as the primary thing that I can give to the board?
Somebody wants to, go ahead.
You've got a background in history for medical treatment, and you are now a teacher at college, and I think you see the youth through the ages, the changes. I'm assuming you've been in the business for at least 3 decades or so,
Mhm.
probably longer, but I don't want to get slapped. And that's the kind of expertise I look for. I look for the background without the bias. And so I think that's what I see in you as the prospect.
So I'd like to, I have to cut us short now because we're running over time. So I'd like to thank you for coming and talking to us today.
Yeah, very much appreciate your time. Thank you.
Very much appreciated.
Thank you very much for having me. I enjoyed it.
Thank you.
Best wishes.
Thank you very much. Bailey's gonna tell Kelly, yeah, to release another.
Okay. Gonna release another from the hole.
I'm glad you stopped it.
It's tough to
Yeah.
listen, focus, ask, be prepared to ask questions and watch the time all at the same time, run the
I
meeting.
am offering the feedback.
Thank you. So the next candidate, I believe, is Michael Phillips.
Hello,
Are you Michael Phillips?
one and the same.
Okay, welcome. Thank you for coming.
Hey. It's my pleasure.
The Board of Health is going to ask you a few questions, and we've been starting. You want to start again, Mary Jane? Okay, Commissioner Weber, please.
Yeah. Put Dennis on the hot seat.
Mr. Phillips, thank you for your application.
Thank you.
We have had a very thorough list of applicants, so some interesting perspectives from all throughout the community. So I appreciate the information that you've provided us. I'm most curious as to know what you think the priorities for public health should be in Cowlitz County.
As far as, you mean, the priorities of programs that need to be instituted?
What do you think are the
Okay.
biggest challenges?
Well, I think
for us?
first, the issue of homelessness and figuring out how to address that. That's a very big issue. I know that there's a concern about the increase in illegal drug use, and how to deal with that, both in terms of the person that may need treatment and the effect that that has on the rest of society. It's not just the person. There are public health implications on not treating and not taking care of the needs of those people that, they go on to the rest of society. I think also that there needs to be fact-based, science-based programs instituted that will help public health in the larger scheme, as far as vaccinations, as far as measures taken to protect people from other potential injury, things like air pollution and ambient noise and things like that. These are issues that have profound implications for the health of the public at large.
Thank you.
In your application, you wrote why you were interested in the position. You said science is not static. As new credible research becomes available, public health policy must adapt. I fully agree. So knowing now that we know that children are the least vulnerable to COVID, would you still have followed the CDC's and the governor's guidelines to shut down the schools for almost 2 years?
I think that you have to follow what the best available information is. When you look around the nation and you see the distribution of where COVID deaths occurred and the procedures that were in place in those and the support that they got, it's incumbent that we be as prudent and as all-encompassing as possible. And when we look around the world, the areas in Africa that did not either have testing or vaccines, they had huge death rates and infection rates. And so I think that I would follow what the CDC recommends. If they have the peer-reviewed evidence that's whatever policy, then I would follow that.
So you would follow whatever the policy is from the CDC?
If it is peer-reviewed and shown to be efficacious.
Okay, thank you. Mr. Dahl?
Kind of thinking that one over a little bit.
If you want a little time, I can go ahead.
Yeah.
So, assuming that somehow you've got the magic and you as a member of the Board of Health can make this one key decision and drive it to success, that is to implement this decision, can you tell me what that would be?
Which decision is that?
That's the one that you're supposed to answer.
Oh.
So you're on the Board of Health and you, by dint of your ability to sway, you swayed the board into a key decision. And I'm asking you what that is.
If I had to make one key decision, I think that it would actually be sort of a combination of things. Reinstituting the drug court I think is very, very important. And I would also advocate for reinstitution of the needle exchange program. If you look at the cost of not reinstituting a needle exchange program, one case of HIV, the drugs cost $1,400 a month. One case of Hep C costs $64,000. One case of necrotizing fasciitis or flesh-eating bacteria can go from $64,000 to $5 million. That's a cost that the public has to pay in one way or another. And so I would advocate for that. And we have seen that the drug court has been, it was supported by all the leadership of law enforcement and the medical community in the county. And I think that for the pittance that it cost, I think that would be, that is money well invested. Just as an aside, we keep hearing that government needs to act more like a business. Well, one of the major causes of business failure is undercapitalization, underfunding. When you underfund public health, people die. Simple as that.
I'll go ahead if that's okay, Kelly. Can you describe what your vision of public health is, how you define public health and compare that with personal health?
I think the public health, it has to encompass both education, giving people the knowledge that they need and the programs available, such as the drug court, such as needle exchange, so that they can make the best decision. If people aren't given the education to know what their options are and what the effect of their choices are, that's a disservice. So I think that education and advocacy for vaccination of measles, vaccination of chickenpox. I guess I've seen enough cases of what happens when people don't follow those recommendations and advice. It's pretty dramatic. It's not something that you want your kids to experience.
Mr. Phillips, in your application, we have in your professional experiences that you've worked with partners in careers, and they describe it as a worrier training program. Is that a typo?
Not worrier.
Worker.
Worker.
Isn't it? Okay.
Yeah, I'm
yeah.
sorry.
Okay.
Sorry.
I thought that was
I'm
the
not a
case.
computer
Yeah.
genius.
Couple things, just to my knowledge, drug court's still going and we still have needle exchange. Are you saying we don't?
My understanding is that the commissioners voted against the funding for the drug court, and it will go through, I think, to the end of next year. I believe that's what the timeline is, and then the funding would end for it. Is that correct?
Well, we voted to sunset a tax.
Right.
Whether drug court gets funded or not, I don't think has anything to do with that tax, but I know
that was-
people think that, but
Oh, I guess.
yeah.
That's part of the education, I guess,
Yeah.
of knowing what funds it, and the information that's been circulated indicated that tax was what was funding the drug court.
Well, it gets part of that tax. Yeah, that part is true, but it doesn't mean it's not going to be funded.
Okay.
I know that seems to be popular opinion out there. In your Cowlitz County deserve to have health policies based on best, and you kind of answered best peer-reviewed science, not personal opinion. You think we've been operating off of personal opinion?
I think that the decision to do away with the needle exchange, I think that that was a personal opinion or I think that that was personally. Because
Isn't there an
as far as
Who's
cost,
running needle exchange now? It's
The-
still here,
Yeah, the Family
Family
Health
Health
Center
Center
has
still
it.
runs
health center, okay.
So that was a situation, that was a state-funded program that had been operated through Cowlitz County.
Mhm.
And when it got to the point where we were distributing around 1 million syringes a month, and they were being left all over in public spaces, we said, there's got to be some changes. And eventually the state turned to the Family Health Center, who implemented some changes.
and
And so it's still going on, less publicity and,
Right.
and
and with, before the county would ended the needle exchange, there could have been, I think that there could have been physical accommodations made, more needle disposal sites, things like that. I felt that it was penny wise and pound foolish, really. And it was driven more by, these are bad people and we're not gonna take care of them. That was my impression.
My last question, I know we're getting close to time. What do you see as, what should be the product of the Board of Health? How I've phrased it with others is, should it be programs? Should it be information? Where do you see, what should we produce?
I think that it has to be both education. People need to be educated on what the consequences, both the consequences of inaction and action, and what the importance of the different programs would be, whether it's advocating for vaccinations, whether it's advocating for mask use. This is the information. This is the best peer-reviewed information that we can give you. This is what works. This is what doesn't work, and you can make your mind up. But I think that that's one. And I think that, as I said, I think that funding programs is really important. Underfunding programs, it really makes a huge difference. When I was a medic, we changed our protocols every couple of years. And we did that based on what the best available science at that time was, whether it was for CPR, whether it was ACLS and the drug regimens that we used, whether it was using CPAP or lifting tarps so we didn't hurt patients picking them up, or back rafts so that they didn't get pressure sores from being on backboards for an hour. They need to be funded. As I said, if we're gonna look at government as being more like business, then you don't underfund it. People die. And unfortunately, I've seen it. And I'll tell you, just as a very quickly, one of the things that I saw repeatedly was people getting low or high in their diabetes, on their sugar levels. And the reason was the meters are free, but every strip costs between $1 and $2, and you test 5 times a day. This is, in one trip to the ER, there's $1,000 without even blinking. So we have to fund public health.
Before we end, I do want to thank you for your lifetime of donating blood. That's an important need everybody can contribute to.
And I would encourage people, I have over 200 either platelet or whole blood donations. And I was the first altruistic kidney donor in the state of Oregon. So, and I would encourage people to do that. There's 110,000 people on the kidney transplant list. And when I did the research, people live longer if they're a organ donor. So don't be afraid. Plus you get a 5-week vacation.
There's the motive.
There's always a bright side, right?
And it's just not, it's not that big a deal. It really is not. So,
Well, our time is up, but if you have any questions, we let the other people ask us questions if you have a question.
I'm fine. I appreciate you giving me the time to
No,
out.
we
Thank you
appreciate
very
coming
much.
by.
We
Thank you.
appreciate your time
Okay.
Yeah.
and effort coming in.
Okay, thank you.
Thank you very much.
Have a good day.
You too.
No, I don't think during this interview stuff.
Okay. Just close that. Okay, well, we've met with all three of the applicants. We have more next week on the 20th at 10 o'clock in the morning instead of 8. And if anybody has any more, without anything else, we'll adjourn this meeting at, depending on which clock you look at, 9:01. Thank you.
Thank you.
That's cool. See you later. Take care.
Nice seeing you, Mary Jane.
I'm good. Okay, we'll kick off with the meeting of the BOCC. And I see Kathy's handing us stuff. It looks like we're going over commissioners and public records. Oh, yeah, I see.
Yes.
Look at, we got
Yes.
our warden sitting over there.
Yes, we have 3 areas today. Kathy Funk Baxter, Finance Director. We have commissioners, including Board of Equalization, and we have Building and Planning. So the first one we have is the Commissioners Department, which is part of the general fund. And so this is the revenues that are particularly just for that come into the commissioners area. And we didn't budget anything, and it's in miscellaneous, and it's $213. So it makes the bar graphs look very interesting. But this is just some miscellaneous revenue.
And all these numbers are as of 8/5.
As of 8/5, yes. And then if you go to the expenses,
I guess I'm curious, I know it's tiny, but what do we get for miscellaneous revenue?
I don't.
Charge for candy or something?
Most of that is actually was unallowed employee reimbursements that we deposited back into the commissioner's
okay.
office. Yeah.
Okay, gotcha.
Yep. Travel related. So on the expenses, the largest expense is personnel. And we are at through August 5th, $419,464, which we don't have the second half of July payroll posted. It will be on our next report. And so we're at 51.8% of budget, which is slightly below budget, but once we receive the other half of July postings, it'll be pretty much on track with our budget. Supplies, very little has been spent year to date, and so the bar graph's kind of skewed because personnel is such a large expense compared to other categories. And then services, we have $76,090 year to date on a budget of $88,053. And so that's primarily because most of our services related expenses are booked in January. So we're a little bit ahead of our targets
That's
for
like
that one.
our bill to IT and stuff like that.
Yes,
Yeah.
IT, risk management,
Yeah.
things like that. Those are the two predominant ones. And for personnel, we have 7 filled positions year to date, and we had 7 at the same point in time last year.
So Kathy, earlier this year, we assumed direction of the employee that was working on the LT1 shoreline rehabilitation program.
Right.
How did we pay for that? Is that money
That's-
that we,
Yeah, that's not in this particular budget. It actually had its own LT1 budget, and the personnel was in that particular budget.
Okay.
And I'm not presenting that today, but if you'd like to, I can bring it back.
and the personal service agreement that usually shows up under services, isn't it?
Yes,
Yeah, okay. We have the personal services agreement with the security firm. That's
showing
taken
up
care of.
in non-departmental.
Yeah.
Yeah, it's not part of the commissioner's budget.
And who determines the non-departmental expenditures?
The non-departmental expenditures fall under the finance area, which would be mine.
Okay. All right.
Question on the FTEs, could you categorically name all the positions?
We have 2 positions that are related to public records. We have clerk of the board. We have the commissioners' positions, 3 commissioners. And then we also have Purvi's title.
I believe she's office assistant
Office
and clerk
assistant.
of the Board of Equalization.
Okay, and for the next year, there'll be a substantial increase on the salaries of the board. That's all factored in. Did you know about that?
Yes,
Yeah.
and that will be for next year's budget when we start preparing those. And we've already started working on all the salary sheets for next year
Okay, thank
and
you.
have incorporated the elected officials' salaries.
Are we counting on a specific increase of the Superior Court pay?
Yes, the way the elected officials' salaries work is that as of July 1, 2024, which we have the number, that is the salaries that are used to calibrate the other elected officials as of January 1, 2025.
And all 3 commissioners will be in that group
Yes,
for next year.
yes,
And that methodology continues on
and continues
year for
on.
year.
Yes.
until the commissioners make a change.
Well, except there's going to be a new board. They may decide that 100% is even better than the
I'm sure they'll all
50%.
decide to cut their salary back.
That's true.
Any other questions on the expenses?
I don't have any. It looks like we're where we're supposed to be, so.
Yes.
Actually, yeah. So we've had some travel recently. That would be under services.
To think about the coding on that. Yes, they're not under supplies. They're under services.
Okay. Thank you.
And on the expenditure side, you've got a little triangle, which I think is labeled prior year to date.
Right.
And that would indicate that at this time last year, we were
We were
about
at-
$150,000 less in expenditures.
Right.
Roughly.
So last year's salaries did not have COLAs included in them. And we also had a position that we had vacant at the beginning of the year that was moved to the public records area.
Mhm.
And so that's why your prior year salaries are lower than current year.
And commissioner salary makes a change too.
Yes.
Yeah.
Mhm.
So that will just magnify the costs coming along. Okay.
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 The next item is Board of Equalization. And this fund doesn't have any revenues flowing through it. It's only an expense paid for through the general fund. And so personnel is actually not a position or positions. It's actually hours submitted for those members that serve on the Board of Equalization. And so year-to-date, it's $5,021 on a budget of $13,888. So we're below our target if you looked at 12 months, but these come in based upon the hours submitted for the sessions that they're working. And so slightly above last year, but I think they were behind in submitting some of their hours last year, if I recall correctly. And so we're pretty much on track to meet budget, actually below budget target.
So the Board of Equalization is a board that the three of us appoint that deals with challenges from property owners who disagree with the assessments the assessor's office has come up with. And so that's a regular cycle, but they don't meet all year round.
No, they don't.
And are they done with their meetings for the year? When do they go back into session with the latest assessments?
Well, there's some things that have to happen. Oh yeah, this is Kelly Dombrowski, the clerk of the board. We do have a presentation for the Board of Equalization after this with the clerk of the board of the equalization, Purvi Reed. But I can just tell you quickly that we don't start until the notice evaluations come out, and they haven't been sent out from the assessor's office yet. So it will start, and then we'll start meeting with the board members, and then you'll start seeing more of them putting in for their payroll.
Okay. Thank you.
And this really is kind of a best guess based on past history, because you don't know exactly how many people are going to want to have a discussion on there.
Correct.
Yeah, exactly.
And last year, for the total for the year, we only expended $3,228. And I believe that's because some of the submissions were turned in. Some of the hours were paid in the beginning, first quarter of this year. So I don't anticipate exceeding budget at all,
Yeah, okay.
even though we're ahead of last year at this time. Supplies, very small budget there, $400, and we've spent $175. And then for services, the budget's $21,075, and we've only spent $8. So well below our target there. And last year we spent in total $7,821. I believe that includes, I'm not sure if that includes where the, if we need to have legal services provided. So.
Think
And
we're
that's
good?
it for those
right.
two departments. And so if there's some other questions you have other than financial. Kelly is here.
I don't.
Good.
We're good.
Okay. All right. Thank you, Kelly.
Thank you. Wherever you want to come up here.
Is there something you want to present?
Yeah, we're
Okay.
gonna present the,
Okay, then I'll walk. I'll move my stuff over.
so I'm Kelly, again, Kelly Dombrowski, the clerk of the board for the commissioners, and we have Purvi Reed here. She's the Board of Equalization clerk of the board. So it's just a seasonal position that she does some of her work for the commissioners. And then I think we allotted 25% of her salary is coming from the Board of Equalization. And so she works on it all year long, but the season doesn't actually start until the notice evaluations go out and we start getting appeals from the public on their taxes. So we have just a little bit to tell the public about the Board of Equalization. So we just want to let you guys know it's completely separate from the assessor's office. So we're a party that is not associated with them at all. And they hear and resolve disputes of the property taxes. So that when they get the notice of evaluation, they come in and they ask if they don't agree with it, then they can put in appeal. And it's for the properties owners that believe that they've been inappropriately assessed or they have some claim of their home that isn't. I say this all the time. Can you hear me now?
Yeah.
Okay. So the Board of Equalization is 3 board members that you guys appoint, and currently we only have 2, so you'll hear about that. It operates entirely separate from the assessor's office, and the board, the clerk of the board is responsible for maintaining the records, serving as the primary contact for the citizens, and also if she needs any contact from the state and stuff, she's the primary contact for the Board of Equalization. She schedules the hearings and she provides administration support to the board members, making sure they can get into the computer, having computers ready. We hold the board meetings here in the commissioner's hearing room, so we provide that. So she's also ensuring compliance. She does a lot of training that she has to go to, and also talking to the state and making sure some of the appeals are legal. So, she also, we have a kiosk out that we put to provide support for them because we have a lot of people that walk in and want to fill out these appeals. So we put in a couple places. We put in where they can sit down and fill them out, or if they prefer, they can use the kiosk in the office. Anything to add to that? Nope. Pretty much said it all. You can go to the next slide, Bailey. So it's This is all a new process for us. We were handed this task last year. And so we kind of went through a process with the state lien team, and they helped us through it to make sure that we were following all the laws and timelines, because there are a lot of date stamps associated with this process. So the first one is the property owner gets the notice of valuation. They have 30 days to appeal. That is also stamped on their notice of valuation, so they should be aware of the date that they have to appeal. There's always exceptions to the rules. They can fill out a waiver, and we have directions on that. They can fill it out online. We actually have a really good process through Laserfish that they had put together. It's very intricate and it does a lot of stuff. I'm really happy with it. I've heard that we are one of the only counties, or we were the first county and one of the only counties that have it as an electronic process. They can also mail in the form. We have where they can print it out online or at home and bring it in, or they can come in and get assistance from the office. So then the clerk of the Board of Equalization can set a hearing date for them, and that is also a timestamp. The property owner has 21 days prior to the hearing to be able to give any other documentation that they feel would help their hearing. They can withdraw within those 21 days, or at the same time when the Board of Equalization sets this hearing date, the assessor office also gets a copy of it. So they're also working with the citizen, and they can either stipulate it and or the property owner can withdraw. If those things happen, it doesn't make it to the hearing. So the process would just stop. If none of those things happen, then the Board of Equalization and the clerk meet and they conduct the hearing, and then the board does an order, and that is what basically is a court order, and that's just what, it's final at that point. The citizen can appeal after that to the state, and I don't think that happens too often, but we had maybe one this year. Just occasionally, yeah. So you can go to the next slide, Bailey. So when we were handed this over, we wanted to make sure that the petitions were handled in a timely manner and hitting all the time stamps that I was talking about. That is our target condition. We didn't quite know what all those were when we had initially taken this on. So we're going to start making sure that we hit those timestamps coming up this next year. So we don't have any data on that. Again, it was transferred to us, which we lacked the necessary experience and training for it, but we have done that training now. We had on here no obstacles at this time, but we are needing one more board member. So they're required to have 3 board members, and right now we only have 2. One of them has, actually 2 of them has retired, and we have one that you guys appointed a couple months ago, and so we still have 1 opening. So the next steps that we took, we did some state training for the Board of Equalization. So she took, I don't know, how many trainings did you take? Like 3. So most of them were all day long. So these are pretty intense, and trying to get the relationships with the state too was really important. So if we have questions, we have somebody to call on. We worked a couple weeks ago. You probably saw on our board back there, as the commissioner saw, that we worked with the lien department from the state to help us through this process so we can make sure that we're hitting all the timestamps and we're able to support the citizens. So the next set of notice evaluations, NOVs, are scheduled to be delivered, I believe, this month. That would be probably more of the assessor's office at the end of the month. So that will start our timestamp, and we'll start getting busy and making the appointments for the hearings. And then next season, we're going to start making sure we keep track of the timestamps and make sure that we're, everybody gets a chance to have their appeal go through the hearing properly. So I have a little graph over here just to give you an idea. Before we didn't take it on until 2023. In 2022, they had almost 300 appeals that they received. And the assessor's office might be able to give you more of an idea why we didn't have that many. We had about half that came through this year. One of the things we didn't know that we could do is there is some requirements that they have to be able to put in to their appeal. And we didn't know at our office that we could, not sure what they, that they weren't valid, that we could be a stop point and go back to the citizen and say, you know, this isn't valid. You haven't given enough information. You need to give more. So we just put them all the way through. So they processed them. We worked really well with the assessor, but now we know there is a stop point at ours. So we did have 146 of them, 38 of them withdrew. So that was a citizen withdrew it themselves. 62 of them were stipulated. So that's with the assessor's office and they agree upon an amount. We ended up having 46 of them that were in a hearing and 42 of them were sustained. So don't know if you have any questions or if you, Purvi, you have anything you want to add?
Sustained meaning we didn't change the value?
Correct.
Right.
So not all property owners have access to the Board of Equalization above a certain value. I know the waterfront industries don't go through the Board of Equalizations. They have their own Board of Equalizations.
I'm not sure about that. Would you guys be able to answer? You'll have to come up to the microphone, sorry.
Josh Claypool, Assessor's Office. Can you ask that question again, please?
So I know not all property owners have access to the Board of Equalization. There's a separate one, and I think it's for the big industries, the huge property values that the state is kind of does that final review of what our assessors utilize for the you know, like the warehousers and the paper companies.
Their first step is the local Board of Equalization. There's a process where they can appeal directly to the state. The last couple of times that's happened, the state sent them back to the Board of Equalization and they went through the same process, everybody else. So everybody in the county has access to appeal their value to the local board.
Okay, thank you.
As far as I know.
Okay, thank you.
Yeah.
Some questions on your very first slide, the last two statements. Could you flesh them out a little bit?
Yeah, the clerk of the board ensures compliance with the a couple of things. Now we know again that we have the stopgap, so we look at the appeals to make sure that they are meeting compliance. So if they're not giving enough information that is needed for the Board of Equalization, then we can go back and request information from the citizen.
So the compliance here just simply means you make sure the process is being followed through. It has nothing to do with telling the assessor's office how to do something or anything like that.
That is correct. We're just, the compliance is with the process and not with.
And the next one, the assist property owners, there it's kind of the same answer, isn't it? You're not trying to tell the property, well, you should claim this or that.
No, we are just with the process, making sure that they have the right forms. They, a lot of calls come in and they don't know how to start this process. So we're helping them with, some of the documentation that they have to bring in. They have to bring in a copy of the notice evaluation. Some of the things that would help with their hearing is if they would go and find out what other properties worth is that are similar to their home. There's just other things, if they contacted a real estate agent that might be able to help them, just giving them some support.
Is there a follow-up in the process? So we go through, there are a bunch of appeals, some activity occurred, some were rejected, some were upheld. Does anybody go back and look at it? I assume the assessor goes back and looks, tries to see if there was a systemic issue of any kind. See, the difficulty here is we're in a very difficult position because we've had, is there something we're doing that would lead us to assess differently? And if we're changing it on some people, why are we not changing it on everybody? That kind of thing. So it just requires an analysis going back.
Yeah, I think that would be best for Josh to talk about.
I feel the appeal process itself is the checks and balances for our mass appraisal process. So if there's anything systemic, we'll find that out during the appeal process. The mass appraisal in general, we have to apply that. What we do is on a neighborhood by neighborhood basis, do a market analysis, make adjustments, send out our notices, and then if we're out of line on a property, usually that's shaken out during the appeal process. We can review that, make sure our value is supportable by looking at market data. We basically do a 3-comp appraisal on each appeal to make sure we can justify our value. If not, we'll either come to the board with a recommended value or we'll stipulate with the owner, yes, there needs to be an adjustment on this property. And
So for the final,
that's our checks and balances.
okay, so for the final analysis, you don't go back and look at the data from a very high level. So for example, suppose in some neighborhood, a majority of the claims came from that neighborhood rather than elsewhere. Do you do any kind of high level? Is there any oddness in the data?
If something jumped out to where we received a majority of our appeals from one area and we needed to take a review of that entire area, then that would come up during the appeal process as well, and we could go back and review that.
But that doesn't happen for free in the sense that if nobody is responsible for going back and reconciling the data with at the very high level, then that probably won't happen. Okay, I think you answered it, and I'm making a suggestion. Okay.
You guys have any other questions?
I think we're good.
Yep.
Thank you.
Thank you.
Gentlemen, it occurred to me that we had somebody in our interviews this morning that might fit this vacancy.
Former senator.
No, one of the applicants. Property owner,
Oh,
landlord.
yeah.
If we need to find somebody, we might.
I'm thinking back
Bye-bye.
of the old press gangs.
Well,
Yeah, you can.
I'm only enjoying this.
I'm thinking she has some background in that.
We have
Oh, yeah, no,
property,
I
so-
understand. I'm
The
enjoying
public
your
records.
company, enjoying your thoughts and just.
and Bailey's gonna do a presentation on public records. So she's gonna do it for me.
I'll be quick since I know that Tracy needs to go unless you guys have questions. So I am going to present the centralized public records data that's taken so far from January 1 of this year to June 30th, so the first 6 months. While streamlining processes, the centralized public records team has enhanced overall compliance, and I'll discuss that further in the presentation. In an age where data is paramount and governance is under increasing scrutiny, the management of public records is a cornerstone of accountability and transparency. I believe that the county's previous approach of the traditional decentralized process of handling public records requests created challenges. And this presentation provides an overview of the initiative undertaken by the centralized public records team within the Cowlitz County Board of Commissioners office. I'll briefly address request response time and request volume, access trends, discuss timely destruction of records, and training and education that has taken place. I wanted to bring up some changes that has happened with public records. On May 15th of last year, RCW 4256-250 subsection 1, an employee's name or other personally identifiable information can be exempt from disclosure if the employee has provided a sworn statement or proof of participation in the address confidentiality program, which is offered by the state. That was a big adjustment. We have not used this exemption, but we have notified employees twice this year that that exemption exists for them. When we send out third-party notices, we added language to notify them of this exemption. And then another big change that happened was case law from April 11th of this year, State versus Department of Corrections. This substantially changed our closure letters that we send out in public records requests. We're now required to notify requesters that their statute of limitations has begun and on what date, and also why we're closing the request and that we don't intend to address the request any further. This is my favorite slide, request response time and request volume. So I can go through it in depth, but I'll just kind of go through it. In 2023, the number of requests we had received the first 6 months of 2023 was 265. The first 6 months of this year, we've received 426. So that's a 61% increase versus last year and this year. I'll skip down to I think the biggest point of this data is the 2023 average days to final disposition. Previously for Cowlitz County was 28 days. In 2024, it's 10. And then the 2022 JLARC County average is almost 14. And JLARC is the Joint Legislative Audit, I can't speak, the Joint Legislative Audit and Review Committee, JLARC. They require agencies who spend over $100,000 responding to public records requests. You're required to fill out that information. It's voluntary if you don't meet that threshold. Previously, the only department that did meet that threshold was our sheriff's department. Since the way we've transitioned public records, we now meet that threshold and are required to respond for the entire county. And then, yeah, the 2022 was almost 14. So we've seen a 65% decrease in the amount of days that it takes us to respond, to either provide somebody records, to let them know that we don't have any records, or that we'll provide them records on a specific date in case it's a more complex request. This is just more of a breakdown of where requests are being received within the county. Overall, there's a large amount of departments who have just seen a substantial increase. As previously stated, there was a 66% increase overall, and then this kind of just breaks down where the increases are. This is just a type of requester. This is information that we're required to submit to JLARC, so I just included it on here. Typically, individuals are the ones requesting records as shown. This just shows the top 5 redaction codes that we use in the county. This is aside from our sheriff's department. I don't have much to add on this unless you guys have questions, but it just kind of talks about the typical information that's redacted and versus last year versus this year. Timely destruction of records has been, it's always the elephant in the room, retention. It's just a hard thing to deal with. And so what we're going to do is have a checklist, just to touch base with all the departments in September, asking everybody where they are with destroying records. And then this will be the actual compliance review from this point forward, done yearly. But since this sort of thing has not taken place prior, we just wanted a touching base document, which will be separate from this, but this will be the one that's done on an annual basis. And then training and education, there's a public records new hire training. Since this was developed last year, 106 new county employees have taken this training. The date that I pulled this data, 91 had actually completed it. And then I created a records retention training that is required of all county employees as of last month, and then every year afterwards. And then I'm also working on updating the public records training to be annual as well. Since right now it's just taken when people begin their employment. And I think it's important that we never forget that everything we do is a public record. So that's all I have, unless you guys have questions.
Who does the police video or the sheriff, the law enforcement officer body cam? That's not included in the numbers we saw?
So no, sheriff's office handles body cams, but the prosecutor's office also might have body cam video. So if a body cam video exists in the prosecutor's office, those have to be handled as well. So that would be included in this data. But
So
I
if
don't have it broken down.
If I call your office and I say, I want this, will you take that task on, or do you delegate that task?
Of actually redacting the video. We
I'm a
would-
citizen, I just want the video.
We would process the request for the PA's office, but the PA's office would have to make the redactions and provide the video back to us for review, and then we would release it to the citizen.
What leverage do you have to have them comply with your amazing response times?
I think that the departments work really well with communicating with both Shani and I to get records in a timely manner. And I think that us just working with the departments is the best that we can do, and let them know this is when the installment of records are due. We need them by this certain day so we can then review them and release them.
That video is a very time intensive task.
Yeah, the redacting of videos is very complex, and it doesn't have, we haven't had a lot of them in the PA's office. I know Julie Harris's office and the sheriff's department has processed more.
I think I've probably said this before, when you make changes, you always make changes to change. When you make a change, obviously you think things are going to improve. And so it's nice to see that what you thought actually comes through, and you have the data to back that up. So that's been a great improvement in turnaround time. It's not an easy job. We get a lot of that stuff, so.
Okay, thanks.
Thanks, Bailey.
Yep.
Yep. Okay, Kathy Funk Baxter, Finance Director, and I'll first go over the financials and then turn it over to Tracy Jackson. The first one is for community long-range planning. And this budget has a revenue budget in grand total of $56,100. And year-to-date actuals, we're at basically $9,213 between miscellaneous and goods and services. It's part of the general fund. So not a lot of additional revenues other than some the largest one is miscellaneous. And so we are year to date on miscellaneous, $4,813. And so our budget is 50,000. So we're a bit behind on that, but I believe that has to do with projects and things that are taken on by community long-range planning. So.
Does this include the plan we have to do with the state every so often? Or is this different than that?
This is, yes, but we don't have that money budgeted and most of this
Yeah,
is
'cause it's not due
VSP
till 26.
2026.
Yeah.
Correct, but we have that funding available right now, $150,000 of a grant that I'm hopeful the board will at least grant us the permission to apply for it. We have to do the comp plan update anyways, so it's money that we can use towards that. We'd like to get a consultant in place. I'll just plug that right now.
Did you identify yourself?
Oh, excuse me, Tracy Jackson, Building and Planning.
Oh, that's who you are.
Thank you.
So we're going to continue to monitor that.
Let me follow up
Yes.
on that. I hear the grant thing, but do we not just, how often do we have to do these things?
The comp plan amendment?
Yeah, are they ever 5 years, 10 years?
Well, every 10 years, but the
But we
previous
don't set
one
we don't
was,
set aside money each year to
No.
build up to do it?
no, we don't.
So then we take from somebody else that can tell us what they want to have in the plan.
We have it's a general fund plan, so we don't hold money over every year for that. It's just budgeted 1 year at a time.
Okay.
Okay, on the expenditure side, the largest budget that they have is personnel and benefits. That's $465,748. They're at actuals year to date, and this again is also through August 5th, $212,267, which as of August 5th, it didn't have the last half of July posted yet. But we are well below, our actuals are well below our target for the budget at this point in time. And we have 6 positions filled, 0 open in community long-range planning. I think these are partial percentage positions, so. And then for supplies, we have $3,850 budgeted, and we only have incurred $194 so far. And services is your next largest budget at $214,050, and $97,000 has been expended. And that's again below our budgeted target. And that is primarily the services that we bill, internal services that we bill in January every year. So I don't see any concerns to make budget or to actually not to exceed their budget as of this point in time.
So, go ahead.
Where do, I was going fine. Where do I find the expenses that are incurred for travel to various meetings within even the county?
In the services line.
That would be in there. Okay. Thank you.
So one of the things that has always been confusing to me when we've looked at the budget is this fund that is labeled Community Long Range Planning, which from the sounds of it is the comp plan, update and review. But we end up spending $500,000
Most of that is salary and benefits.
for reviewing the comp plan.
For providing that and doing other projects.
So
VS
I know that we also have, we approve every year the list of fees
Mhm.
that are charged for people who are making an application and staff is reviewing it, making sure it aligns with the comp plan. Where do those fees get listed?
The fees for particular permits are with the special or the enterprise fund, the other fund, the big fund.
The building and planning fund.
Yeah, the community long-range planning is general questions at the counter. VSP, money goes in and out of that we contract with Conservation District, comp plan updates, that sort of thing.
So-
General planning.
So when we have our discussion with the fees every year,
Mhm.
my impression has been those fees are set so that there's cost recovery.
For the permitting
But what
piece,
this
yes.
document says is that we're subsidizing the counter work to the tune of about $500,000 a year.
For the community, yes.
That's not, I mean, so those fees don't really, they're not recovering all the costs because we have
Correct.
the counter.
Correct, because the other ones are the ones we cannot tie directly to a permit. If they're tied to a permit or permit-related work, they go into the building and planning enterprise fund because it is cost recovery. They're paying for what the product that they get, the community.
As I review these charts that Kathy makes for us, there's always a disconnect because the first page is always revenue, only it's not the revenue. It's only a certain portion of the revenues.
Right.
And it's very confusing because, it would assume that we've got an unlimited supply of money for a department that only brings in $50,000 a year.
It's a very limited
and it's
revenue.
just,
Yeah.
I'm thinking about a citizen who's trying to make sense out of all this, and we make it difficult. It doesn't seem to make sense. Even though if you ask the right questions, you kind of figure it all out. But I don't know if there's a better way of identifying the general fund as a revenue source, as a line item, so that, it just seems to me your revenues are supposed to balance your expenditures.
Right.
And
So what we could show, if we want to take it that direction, we could show for general fund categories, we could show a transfer in from the general fund, but the revenue from general fund predominantly goes into two departments, auditors and treasurer's office. That's where the predominant amount of our revenues are at for general fund.
And if you transfer it in from that, you're just adding more work for a transfer line for 3 different offices between her office, treasurer's office, and the auditor's office. If you were to transfer in this money every year.
Yeah.
If it's any help, I think you asked an excellent question and I don't know the answer.
Yeah.
With the
I
large.
don't want our documents to be setting you up for public criticism.
Yeah.
All these things, they don't balance. Doesn't make any sense. And yet
Could
we
possibly
know the
change.
money comes in.
We could
from-
see about changing the title, but state auditor watches the ins and the outs of the permitting pretty closely. And we can only charge the permit fees for what we're actually taking in. In and versus out.
The thing that is useful, I think would be useful for me is if the revenues, well, we can show the revenues matching. It's going to be the same number. The differences, it should be listed. But the key thing is, how does this compare with the previous year? Are we off the charts in
Right, and-
expenditures? And that's what your dots and your triangles are trying to
Trying to-
indicate. Those
to
are critical
dictate.
things. And then the other thing that you've begun to do is to show if we've got vacant positions, because that can skew the expenses.
Yep.
You're not
Mhm.
expending the money, although you have the people
Yep.
budgeted. And we know that that's sometimes a useful disciplined approach, because it helps create an ending fund balance that we also need.
Yeah, and when I do my finance department presentation, I spend some time showing you general fund total revenues versus total expenses, and we'll talk about that in a minute when I get to those slides. So that's where the balancing of the general revenue is, as well as road fund. We picked 4 funds predominantly to show: general fund, road fund,
And health department.
yeah, building and planning and health. Mhm.
I just know from the work for the years that I was on city council, it wasn't this complicated. And yet they all use the same bars format, and they have to respond to the state auditor. So
Right.
I want it to be user-friendly, to show expenses and revenues where it makes sense.
Maybe for those departments that are general revenue, maybe we don't show their revenue. I don't know. That's one idea.
And then just put it as an ending fund.
Mhm.
In the private world, there's a term, general and administrative expenses, G&A. Am I
Mhm.
correct in thinking that this 465K is a lot of that? Because you're not able to pin it to a specific job.
Correct.
Correct.
It's portions of my salary, Mike, Wayne, and other department workers as a generalized, because I don't touch just
Yeah,
permits.
And the reason it's called community long-range planning, maybe
It's a
that's
s-
what's
that's-
misleading things.
I have a title change with a question mark. I made note. It will follow, we'll do with the state auditor and the auditor's guidance. But we'll go see if we can get maybe that changed. That may help clarify.
Okay.
Something, yeah, to call it something different, more intact with what we do.
Thank you.
And then following up on what my colleague said, I don't know if there's ever exceptions are hard to deal with for the most part, but I think if this showed in the revenue transfer from general fund or something like that, maybe that would
That's all you
help,
need.
because I know he is correct. It's going to cause people to wonder what exactly is going on here. Something to think about. Like I said, I don't know the answer. I just know the question.
Maybe PeopleSoft doesn't allow you that flexibility.
No, I mean.
I don't think it'd be a PeopleSoft. I think it'd just be more hands-on for her department and 2 others to do the journal entries and the transferring of the funds in between interdepartmental. It'd show up as an inter-fund transfer and then an inter-fund deposit.
Tomorrow, it'll
Mhm.
be how we program the AI engine.
Yeah, and from my previous experience in dealing at universities, we collected tuition and fees, which were general in nature, and we did do an allocation to show those funds being pushed to, general and administrative departments, so we could show how they were supplemented because they didn't have their very specific revenue sources.
Thank you.
Okay. And then the next set of financials are actually for the enterprise fund, which is building and planning, which is where the fees and the revenues are generated that cover their expenses. And so they have licensing and permits budgeted $1,688,000. So far this year, they brought in $947,631. It's lagging a little bit compared to our target, but not significantly. So we'll just keep monitoring that. Goods and services is 1,308,000. And they've brought in so far this year, $833,533. So that actually, on the other side, that is actually exceeding our budget target year to date. They're showing at about 64% of budget. And so one is a little bit lagging and the other is ahead of schedule.
The licenses
budget.
and permits, the lagging is something that shouldn't be unusual, right?
We've brought in more than half of what was expected though, so I don't know why
Yeah.
it shows lagging.
Because this is through July, through seven months, so.
Which is interesting, because if you look at our year-end reports, month-end reports for July, we've brought in more.
Exactly what I was looking at.
We've
yeah.
brought in more, and the value is obviously increased too, because the values are higher.
Yeah.
So this is,
Okay.
So in your department, the revenues really peak during the summer months because that's when people are,
actually, late winter,
Spring?
early spring.
Yeah.
Yep, because they start their projects. We still have people coming in the door trying to get their stuff done before the rain comes.
Although possibly the do-it-yourselfers or
Yes,
that peaks
Yep.
in the summer months. That's when people.
we have a lot of alterations on what
Right,
they currently
right,
have.
okay.
Yep.
that
I
would
guess
make
the
sense.
underlying question, going back to the sheet you mentioned, is you're predicting things, and if we fall short, that may have much larger implications.
It could, but then one large project, a commercial project comes in the door and we can exceed our budget right then and there. So what we predicted. So we don't really know what's coming in the door. We make our best guess predictions at the time when budgets are due.
So you'll remember when some of those huge projects were being considered and we were collecting millions of dollars every year and budgeting
Yep,
and adjusting the budget to whatever the current permitting
yep.
procedure
It's ebbs
was.
and flows. We try to make our best guess of what we know. Preliminary work's been done on larger projects to kind of plan for some of that revenue, but some of it's just whatever walks in that door.
And the state would make decisions that would force additional permitting fees.
That's on always.
There was a whole bunch of money made.
So yeah, I know we acted as a pass-through before on some stuff, like the Millennium Bulk Terminal.
Some, yes, but some was done in-house, yes.
Yeah. So now if I'm a new company, or I'm in town and I want to build something and I go to talk to you, that is billed to my account, if you will. You will talk to me for free until I actually submit an
Absolutely,
application?
absolutely. Many times. We have staff consults and we will repeat them and add additional members if we need to. Absolutely. It's a benefit for all of us.
And that's the long-range planning funding.
It's a free service that we offer the community. It's
Yeah.
not, yeah,
I mean, so that's that long-range planning
Yep.
where you're.
kind of, but
so-
it's
so
permitting
much
that we're
available
not,
That you're not recovering it.
or it's
in
permitting
fees.
that we're not collecting any fee on. Yeah.
So are there, probably a silly question, if I am contemplating coming in with a substantial industry of some kind, I would be inclined to chat with you for a while, get to know you and all that, and I could take up a lot of your time.
Mhm.
But you don't have a project yet because I haven't applied.
That's what we do, correct?
Okay. What would cause me then finally to apply if I'm get all this help for free?
Well, you want a certificate of occupancy at the end of it if you're building something, so you would need to apply. Your plans would need to be reviewed and we would
Right.
go
but
through the
my
permitting.
question is, I can get a lot done before you actually charge me.
Absolutely.
Okay. I'm not saying it's bad.
No,
just
and that's what
understanding
that's why we're looking. I don't believe we've made a total decision yet, but I don't believe we're increasing the fees for the 5th year in a row. I think we're making do with what we have and the staff we have.
I think it's a good twist to follow that. I mean, we don't want to scare people off.
No, we're trying to encourage.
No, I think it provides a benefit. I had a business and I don't know that they're ready to say they're coming in, but they sit down with you folks and had nothing but good things to say compared to Clark County is what they were
Yeah.
comparing it to. So I think it provided some real benefit. They were happy with the sit down and
Good. We bring in other departments too. If there's water and sewer, a well and septic, we bring in environmental health and public works for right-of-way road approach permits and any kind of road construction that they may have up in front of them. So we try to broaden who we bring into the room for the audience that is needed.
yeah.
So.
I think if a company like this is going to talk to a different county and then talk to this county and try and decide where they're going to go, it appears to me we have an advantage because I think we've been working pretty well with these folks.
Yeah, as a minor useless example, when I first left California to come up here, it was because as I was up here, I dropped into a public office, like the assessor, and asked a question, and I felt like they actually cared. Even the DMV would so much better here than in there that I think, no, I'm going to move up here. These people they're trying to help.
So Tracy, in the processing of these pre-planning or pre-conferences that you talk about, it seems to me that one of the real critical early decisions staff has to make is whether this is a proposal that qualifies for a declaration of non-significance. So an impact statement's not necessary. Do the charges start after you make that preliminary determination that looks like this is going to be a DNR, or do you start charging before you get to that point?
Nope, not until they actually apply for the permit. They can come in and ask, any questions or any process they want. We get it all in place for them and we hopefully send them on their way with, kind of like the list that they need to work on or bring back or submit. But it's not until they actually apply for the permit before we charge.
Yeah. Okay.
But we do give them the obstacles ahead if there are obstacles for environmental, for the SEPA determination. Yes. We try to give them all the tools so we don't get blamed. We didn't, nobody told us. We're trying to tell them.
I was approached once, as we all have, in a restaurant. And somebody on the wait staff said, "You're a commissioner." You always know that's that opening question. And he had purchased some property that had been formerly a tree farm, and he was going to build a house. And there was some restrictions that he knew about, some rock outcroppings and BPA power transmission line. So his buildable area was restricted. And the previous owner had some artificial creeks, waterways to irrigate the tree
Drainage.
farm. Yeah. And initially the staff consult said, "Oh, we have to determine if that is a wetland or not." And they consulted with the wetland expert up in Olympia, I guess, and came back that yes, it is. And that he had to do this very elaborate planning process. And he said, "It's 3 feet by 6 feet." It was the puddle that was left. And on further review, the process, they cut through all the red tape. The staff was very proactive in saying, send us a picture in 5 years that you haven't changed this. And we're okay with it. It was a very simple thing rather than 100 different species had to be planted and monitored all the time. And the reason I say that is that's my way of saying, way to go. I mean, your staff continues to be looking for opportunities for customers to win while we're complying with the rules and regulations, there are ways to do it with accommodations that make this county, I think, much more user-friendly, I think, as my colleague discovered. Anyway, I just
Well, thank
appreciate
you.
the openness
We
that you
are
continue to
trying,
work
and like
on
I
those
said,
things.
the staff down there is top notch, and we couldn't, I mean, I'm just the face for the department, but they're the workers, so kudos to them.
Yeah.
Couldn't be a department without the work they do.
Even people who come to me furious with the department, you work with them and finally they end up admitting, well, yeah, I was mad early on, but they worked with us.
Yeah.
And we were able to accomplish our goals. So
Good.
thank you.
Do you want me to go over the expenses for building and planning? They're pretty much on track with all of their expenditures. Their largest expense is personnel at $2,199,000, or almost $2,200,000. We haven't booked the last payroll in July, so it's a little bit lower than this point in time last year. But I don't anticipate there's any issues with their meeting their budget. And
A correction on the bottom of the, we have 24 department-wide, no matter which fund they're paid out of. We have 24 budgeted positions, but now currently we have 2 vacancies. Our permit specialist, the latest one that we'd hired, she gave her notice. She's going back to working her previous job. So we're not gonna fill that at this time. We're gonna see kind of where the push is. And if that position is needed. It's not slow, I mean, it's not slowed, but we don't have the hype from the winter and the spring right now. So we're kind of maintaining at the counter. So we're gonna see how we do with just one permit tech or permit specialist and one planning specialist.
So to be sure I understood, that 16 should be 24.
Well, this is just this fund, so it's 16 and it'll be 16 and 2 that are paid out of this fund. Yeah,
Okay.
The community long-range planning had 6.
picks up the other ones,
So
yeah.
that's the rest of it.
Yeah.
We're confusing.
okay, anything else? I'll turn it over to Tracy.
I'll talk quick, I promise. Let you know the vacancies. I handed out the monthly reports and they're online. We've put everything online, the monthly reports for 2023 and 2024. And we've also put all of our forms that any applicant needs. They're all fillable now. So that should help any customer come to the counter. They can self-serve at home and do the application paperwork that they need. Last week or week before, I don't remember, apologize. We were not gonna have a planning commission meeting for August, I told the board, but we are gonna have one. We're gonna do a special meeting on the 20th. The 21st, we don't have a quorum, but the 20th, we were able to get one. So the day prior, we've worked it out with KLTV to have it recorded and have the Zoom link available. But we have an applicant that is, itching and ready to go, and we don't want to hold them up a month. So we're going to have a comp plan amendment and rezone on the 20th, same time, 5:30, same room in here, but we just, we moved it to the 20th. We have our normal Building and Planning Advisory Committee meeting this Thursday at 2. We have gone leaps and bounds with the private road standards. A recommendation will be coming forward, I think, from Thursday's meeting next week or the week after to you guys, the board. I believe the recommendation will be for the way the standards are kind of being shown right now. Short plats and large lots, building and planning will be reviewing for private road standards. We've lessened some of the county road standards from the county engineer, and there'll be those requirements and recommendations will be coming forward. And then anything over that for any subdivisions will be county roads. And so Susan will be taking a look at those. So I think that'll be the recommendation. And then Mike has a short presentation if you want to see it, unless you want us to kick it for time wise. It's on the building code for ICC. It was kind of the Cowlitz County's version of maybe what Woodland did. I think, wait, 8 or 10 slides. If you have time, or you want us to kick it to the next?
So before we do that, Tracy, I'm looking at the monthly permit reports, and it year to date, it looks like about 45% of the revenues in single family homes, and about the same amount in commercial and industrial, and then about 10%, I guess, of the total is mobile homes. I'm not good at doing math in public, so the percentages. What are the big commercial projects that have? Is that a Mike question?
I'm going to bring Mike up.
Okay.
Yeah.
Still green. Okay, can you, this is Mike Wilson, Building Planning. One of the big ones is EGT expansion down at the port. That's currently in the stage of casting the concrete silos. Those are commencing now. They've done all the foundation work and so forth. Then we also have the project which is kind of on hold now, the manufacturing of the wood pellets. There was a contest about the air quality. So they're kind of on hold. And then we also have a metal recycling project also down there at the port. They just receive metal, crush it, do whatever that they do to process to be a part of their product stream. Also, Warehouser is building a new administrative office up off 500 Burma Road.
Oh.
That is their plans are just in the process, are just about into approval. So they'll be breaking ground on that very shortly. And then we have some others that are, on the horizon, an asphalt processing plant. In fact, you talk about complexity of jurisdictions and so forth. They chose us because Clark County was so difficult to deal with. So, and in their opinion. So it was good to get a traction of their business up our way.
That's the one I was talking about.
Yeah. So that's what we have going on now. We have a few multi-family projects on the horizon, I believe some triplexes. These will all be, residential, commercial type buildings. So
I noticed a newspaper article yesterday, I think yesterday or the day before, in which triplexes are being built in the Highlands. It's not a county project, but it's something that the city of Longview is going through. And they're getting some pushback from the residents because they're not providing enough parking. And I couldn't help but reflect on the fact that the state legislature is changing the zoning laws, requiring multiple family developments along bus lines. The assumption being those folks can rely on buses to get back and forth to work and shopping and all those kinds of things. So that'll continue to be a problem for the Highlands area because bus lines go through there. And we dodged a bullet perhaps since the folks in Lexington decided not to exercise the bus route option. So but it is always interesting. The legislature does make decisions that have impacts on local zoning that despite the fact that we set our own, zoning and comp plan amendment and all those kinds of things, it's within the context of what the state tells us what we can and cannot do.
I don't know if I should comment on that or not, but
No.
we have a little bit of the bus, the city transit that goes in unincorporated areas, but not much. It's mostly inside the cities now. It will have an impact.
I think I did see that taxiing issue up in Lexington did not pass for the.
No, they did not.
Yeah.
Did you want Mike to go through the slideshow or do you want us to do it a different week?
I'm pretty good with the
Sure.
slideshow.
Sure.
Okay.
You want to continue with this?
Bailey will kick it in for us.
Okay, I have to get my cheat notes then.
You know, this could become a movie.
It could be. Blockbuster. You put it on YouTube.
Conspiracy.
Yeah.
So what you have before you is a brief history of the code. You can just go to the next slide. Okay, so it begins with the International Code Council. That's the model codes that state of Washington adopted and are pretty much adopted throughout the country. As you can see, international codes most widely used throughout, well, they're used throughout the world, but most primarily in the United States. ICC is a nonprofit organization, but their offices are based here in the United States. And their bylaws are available on their website. There's a plethora of information available on the website about their history, their structure, and so on and so on and so on. So next slide. It was formed in 1994. And it was the agreement of the 3 dominant code councils throughout the country that decided to do this. With the history of the codes generally were just a product of local jurisdictions, cities, counties, towns, whatever. They would make up their own codes, and they would, abide by the best practices and so forth. But out of that came the 3 dominant code councils, and ICC was formed in agreement of these councils to create a model code that could be used universally. And the codes are published on a 3-year cycle. Next. The council has 18 board members, and these board members are from the government sector. And they basically drive the themes, the mission of the Code Council, and the mission, of course, is the development of the codes and to work with the communities, and in this case, the country in which these codes will be adopted. The ICC has huge staff, and the ICA, their CEO is the one that interacts with the board, takes their cues for, driving the mission. Next slide. Okay, so there are 64,000 members in the ICC throughout the world. And you can see the list that they comprised of architects, engineers, contractors, manufacturers, government officials, students, and anyone else who cares to join and be part of it. As I said, it's a great resource, the information that they provide, that which is online, and also the availability of staff in the ICC. They're pretty responsive, and especially when you cultivate relationships with them. I've used a particular individual through the years who was more than happy to help. He was a registered architect, been on the staff for a long time. And it's cultivating those relationships, that partnership that, are able to get things done. So anyway, next slide.
So Mike, do I understand though that the board of this council are only government officials?
It's comprised of government officials.
Okay.
Now, whether that's a mandate that they've created themselves, it's a private organization, and that's what they've agreed upon.
And is it a top-down type organization? We will tell you what to do type of thing?
No,
Or are they collecting what everybody does to try to?
Right. You'll
try
see
to
that
make
it's a
some sense of it?
consensus driven, because, one size doesn't fit all.
Mhm.
And as you see these slides progress, it's consensus driven where they receive input from various stakeholders, the communities, the jurisdictions, throughout, the world, specifically in this country. And say, for instance, you want to suggest that there's something that may be lacking or something you want to do. Now, whether you want to incorporate or insert the lobbying aspect of it, that's a whole other discussion. But anyway, yeah, that's the way it occurs. It's described in the next slide. So. So this is what they do. The ICC, is code development, training, education, personal certification, because personal certification, so it demonstrates that the people that are actually, providing the oversight inspection services, we have agreed upon that there's a certain level or a certain minimum standard of education that they possess in order to do the work that they do. So we have product evaluation and certification as well. A company that fabricates for the industry, say, for instance, they produce steel for one of the projects down the waterfront. Does the steel meet the requirements necessary that the engineer specifies so that someone's not fabricating in something out in the back shop someplace? Does it actually meet the requirements? And there's a auditing process that they can subject themselves to so that there's confidence that they meet the criteria. There's special inspection process and so forth, but a company can be accredited as acceptable in the industry standards. So there's product evaluation certification. This is a broad, across the board, from everything from materials to products to processes and so forth. Where special inspection is mandated by the code, this product evaluation certification process covers that. And as I mentioned before, there's technical support and consulting services. I've used them frequently over the years. You can also actually hire them, basically send product, to them, or I should say plans and so forth, and they will do that, provide that service in the absence of anything better, so a good resource, generally speaking.
And that would be listed under services, right?
Okay. So the building codes, there's no central governing authority responsible for the National Building Code, and it's developed, as I said, through a private and public partnership, and led by the ICC. They just simply, they receive the input from all over the world as to best methods, materials, practices for construction, and they arrive at codifying these things. Next. So as we mentioned before, it's a consensus-driven process. Code changes can be submitted by anyone. These usually occur from the jurisdictional level. Inspector may discover that there's something repetitively failed or is troublesome or maybe lacking understanding between the product manufacturer and the installer, or they may find that there's a life-saving value that's overlooked. A good example would be that which for a long time basements did not necessarily require an emergency opening. This is obviously a hazard to life. So there was a code change that was submitted, this is years and years and years ago, but that an emergency escape, at least one emergency escape opening be provided for basements. So that's a good example. There's a hearing process, and of course, the public can comment and ultimately arrives at a conclusion in which the changes will be published in the next edition, which is, like I said, on a 3-year cycle. In the interest of time, I'm going through this kind of fast, so if you have questions, feel free to jump in. That arrives, then we arrive at the Washington State Building Code, whereby the state of Washington has decided to use the model codes published by the International Code Council. And the SBC, the State Building Code Council, was created in 1974 by the legislature. And they chose to adopt the I codes 2003. Up until that time, the 1997 Uniform Building Code prevailed. But the body of codes that the state has adopted are enumerated on this slide. It's quite extensive. With the exception of the Uniform Plumbing Code, which the state chose to maintain, all of the rest of them are the international codes. Next slide. So the codes were enumerated, and of course, this drives the building, the built environment for which the code requires inspection. And it comes to our doorstep to review the plan. So I should say, accept an application, review for conformance with the code, and then perform inspections. And this whole process now is available in our county using the cloud-based Acela platform. And as Tracy had mentioned before, we now have a vacant position in the front counter. And, as she said, we're going to carefully monitor this because we're meeting a need of the public. How many people walk through the door? But as electronic applications evolve, fewer people may need to walk through the door. There's always questions, and there's always the ability to assist someone with this process because, as technology expands, not everyone wants to play that game, and I can understand that. So we always must have people available at the counter and to assist them through the process. But this has been a great tool. I know the commercial side greatly enjoys and benefits this because they were well ahead of this and we're doing this regardless. So this has been great as far as transmitting documentation, coming to agreement, processing and so forth. That's been the model. We implemented this just before, paperless just before the COVID. But Acela we took on in 2014, I think it was. Anyway, and it's just been getting better and better. As we become more acquainted with it, the public becomes more acquainted with it, it just improves the service. Next slide. Now, maybe I should have opened this with this one. There's yesterday, 1949, and I just happened to pick 1949 because I had a copy of that code in my office. And there's 2024. You can see where the world has taken us. Basically, the building industry was regulated by that book, and now it's under the regulation of a whole pile of books. Now, granted, materials, methods, and so forth have evolved greatly over the years. And the 1949 issue, at that time in the country, there was fundamentally a building code, and all the specialties were directed through technical papers, technical bulletins, agencies such as UL, Underwriters Laboratory, or NIST, National Institute of Standards and Technology. All these different agencies would publish the ways and means of doing things on which the code would cite and rely upon. That said, 2024, even though we have a nice big stack of code books, there's also 54 agencies that are cited as standards within those. So there's more agencies, there's more codes, there's more of everything. So I don't know if more is better, but there we are. The greatest change that occurred, I should say philosophically, the greatest change occurred is that under the previous codes, which most were built through the 1950s, has taken the exceptions out of the code and created their own code. For instance, residential building. Residential building was always an exception to the code. Made it simpler. As far as the reasons for doing this, that's a matter of opinion. Don't really want to go there.
I'll go there.
That's why I said I probably should open with this slide. But anyway, that seems to be fundamentally the philosophy of it was they removed the exceptions from the code and created a code for themselves. Which is why we have such a nice big stack of books.
I'll just offer some comments if you're okay with that. The ICC, my understanding, it was driven by a lot of manufacturers because they had different specs for machines in different parts of the country and they wanted all uniform. You could also interpret that as manufacturers protecting themselves for having uniform things that only have to go through them. Of the 64,000 members, most of them are manufacturers and stuff.
As I mentioned, lobbyists are.
And the process of changing code, if Commissioner Mortensen's tinkering in his garage and he finds, wow, I think if I add this to siding or I make this little adjustment on an air conditioning unit, I can make it 50% more efficient or last 10 years younger. I should build this product and sell it. He can't do that because it's not part of code. Now, he could appeal to the ICC and go through this process, but what do you think the chances of the manufacturers protecting their product are going to let you do that? This is to me, and I'm not arguing with you. You can say, well, we'd like everything uniform so everybody knows what to build, but then you take away the person's ability to develop and something to make something new. They're really protecting their own products. And by making the whole world or the whole United States to set to these deals, and then they bleed them on down to the state, and then the state just accepts it. So I get why it was done, but I think some of the reasons it was done is more nefarious than public good. And when I heard that presented down there, that's all I could think. I said, well, hell, these people are just protecting themselves. Anybody that comes with anything new can't even get it through anyway. It's nonsense. And it's not the way America's built. So I guess I just wanted to have the opportunity to point that out, that these things aren't protections for the consumer. These things are protection for the manufacturers.
And much of the code, the way it's written out, it relies heavily upon the manufacturer's specifications and installation requirements. They'll just simply, instead of providing a prescriptive way to do A, B, or C, they'll cite that this must be installed in accordance with the manufacturer's installation requirements and their, ICC certification of, whatever that capacity is. For instance, you can have a product or that's vetted through the ICC. It receives an ICC number, and we can rely upon that this is the proper instructions. Their instructions have been investigated and found to be acceptable. So we can take that document, apply it to the permit, and we can have confidence that this is the way it should be done.
I have confidence that you guys know what we're doing. I think it should be totally opposite. I think Cowlitz County should be able to do their codes, and the manufacturers, if they want to sell product here, should adjust. I don't think it's the consumer that adjusts to the manufacturer. I think it goes the other way. And I just think we're backwards on this. And I would love, I don't know how to push back, but I almost see this. We're just picking on this one industry. They do it on everything.
Yeah, I almost disagree with you on one little aspect, which is the assumption that we need to tell someone you must use Cowlitz County codes. Certainly, it's a big improvement over having to use the codes for Baku or Casablanca, something like that. One of the things that that escapes the public often, there are a bunch of things to say. I agree with what you said. People don't realize the absolute complexity that's in here, the signaling traffic going through the phone, just as I'm holding it, would flabbergast most people. Is it mandated by the government? Nope. Did it get to where you have a phone like this? Nope, if the government had control over it, you'd have a brick.
You'd still have the bold box.
Yeah, and this was all done by industry's self-interest without the leverage of a government mandate. In your case, the industry's looking for the leverage and using the government because they say it's for your own safety, your own good, and so forth. One of the things that flabbergasts me is that we don't make a distinction between a public building and a single-family dwelling. And that should be pretty distinctive. We can let people build whatever they want for their house and all that, but when it comes to building a building like this, I think there's comfort in having an assurance that it was done well with good steel and proper concrete. So I think it'd be a hard sell to say you can do anything you want with a public building. The other thing I wanted to do, and it requires the title companies to assume a greater responsibility to information like, do I care whether this building was inspected by the county or by Underwriters Laboratory or by any of the construction outfits? I may have a preference as a consumer, like if I'm going to buy in the old days a good computer, I might look at Hewlett Packard versus some other computer just on the reputation itself, but that would be my choice. We take away that choice. We could put that choice in rather easily in law. All you have to do is say you are allowing competing inspection, and the title companies would say, ah, yes, the property you're interested in was inspected by agency A. And the market would then define whether you're going to end up with a brick or a cell phone like this.
It just distresses me when we move away from market-driven things as far as we do at times. And I'm not picking on you, Mike. I have a lot of respect for your knowledge and what you do. And I appreciate you presenting that just so I could comment.
But that's not to say we
Open discussion is what it's all about.
That's not to say that we don't enjoy picking on you.
Yeah.
It's okay, I've developed a thick skin.
Yeah, thank you.
Thanks.
Oh, we
Did-
actually have another?
Tracy, did I detect a new logo for the department?
A BP.
British Petroleum. I was wondering what the connection was.
You gonna be around later?
Right here?
I got some questions for you.
I'm not busy, or I'm not here now. Oh, that was easy.
Yes, I realize that.
Okay. I'll be quick. And basically finance, I have presentation and it's very condensed this time because I didn't have document recording fees to report, which I normally do, but the new person needs to be, we have some training. I think they're training a new person on preparing the reports. And so we'll catch up on that on our next presentation. Basically, I'd like to just jump straight to the last slide in the handout, which is sales tax, which is one of our primary revenue sources. It's still, for the 5th month in a row, it's still lagging compared to prior year. So in total, year to date through May, earned revenues, we're about a little over 500,000 below where we were last year at this same point in time. And so for budget though, I did budget lower than our last year's actuals. So we're year to date at 37%, but to be on target, we would need to be at 42%. So as you can see, we're about 5% below where we need to be at this point in time. It's the fifth consecutive month we are below our projections. And so I am concerned about where we're headed for the year on this budget. This particular budget, our property taxes are fine, which is really our largest revenue source. But this particular one, we're off, and so I'm concerned about this. I think we should put out a message to our departments, that our general fund departments particularly, that we need to conserve our resources as much as possible and to make every effort to reduce their expenditures for the rest of the year. So if that's okay with the commissioners, I'd like to put something out to our departments.
I think that's always a good idea.
Yeah.
But
Based on what we're seeing, I don't think
Yeah.
it's going to change here.
And it's a little more alarming because we've been if we purchase the same number of items, we would be purchasing them at a higher price. hence
Right,
a
with
higher sales
inflation,
tax.
yeah, inflation is running a little bit over 3%. So we should be up at least 3%, but we're down. And so I'm concerned about this
I think
particular.
today, we're supposed to hear, maybe to close the business, the new PPI and CPI.
I don't know, probably for the month of July.
Month or quarter, I'm not sure.
Yeah.
That one.
So one of the sources of sales tax revenue that we used to track at the city of Longview was auto sales. Because both Bud Clary and Columbia Ford had state contracts. And the purchases for those state contracts were booked in Cowlitz County and generated, I mean, it was a fairly significant source of revenue. Well, Bud Clary and bought out Columbia Ford. And it looks to me like they've also made a corporate decision to run it through a different county. Because every time we turn around, it's a 0.1% sales tax increase. And that keeps their margin of profit. I mean, it really nails them because they're competing with the rest of the state. Is there any way that you can double check to see if that indeed is happening? Clary has dealers in Yakima County, and that's what I'm assuming is the beneficiary of our loss of revenues.
That question came up before, and I think it was confirmed that they are. I don't know what county though.
That they are going to a different county.
Yeah. But I don't recall which one.
So,
but I think your assumption is correct.
So we're looking at not quite $1 million shortfall,
Right.
we're
So
half a million.
If I were to annualize this 500,000, it's over $1 million for the year that we might be down compared to last year. But like I said, our budget, I budgeted 11.9 million for this particular item versus 12.6. So
we did anticipate some, it's just fallen farther than we thought.
yeah, it's fallen farther than I had budgeted. About
So
to the
that
tune of
is-
about 5%.
So at the risk of being too simple in analyzing that, we're talking about $1 million shortfall. That's roughly 10 employees.
With benefits,
So my
yes.
question would be, how many of those employees are vacant right now?
Yeah,
And then we have to remember, okay, no, when the department head comes and say, now we need to fill this position. I said, well, I'm sorry,
and what I'm
we're at the point where we need to start saying no, and we're not used to doing that.
And what I'm seeing is also on your vacancy, on our vacancies comparing, we actually are not, we don't have as high vacancy rate as we did last year. So that's a problem too.
By that, you mean the open positions are fewer now than last year?
Yes, yeah.
And we were,
And
and we pursued that budget time. He says, why are we holding all these unfilled positions? So that probably means you need to sit down and discuss where we go from here with Jessica. Because, she's the one that brings the request for new hires to us. And,
Yeah, I think we want to be very careful here because any blanket solution isn't going to be that useful. I think, for example, in the prosecuting attorney's office, it's hard to fill a position there. And then if we get a stellar person to apply for a job, I'd rather take a chance. Never turn out the talent. It may be just my history at Qualcomm, but we never refused to hire somebody that was top notch. And we were on the balance of going bankrupt a couple of times. In fact, the vendors wouldn't sell Qualcomm anything unless it was cash up front. But you know where Qualcomm is now.
Mm-hmm.
Yeah.
We don't want to be, anyhow, enough said.
Yeah.
I think we're
And
just pointing
Well,
out
and again,
different
it
ways to
depends
look
on-
at how to cover this, but I think
Yeah.
you're asking just a general statement. Let's start looking at our expenses, make sure we're.
Right. I
Right.
just like a general statement at this point to say, we're seeing a revenue shortfall on our sales tax revenue, and we're asking everybody to participate and help us by conserving resources. And in some departments, they may not have any vacancies, but they may be able to save in other areas. So,
And there's a difference between departments that are not general funded,
right.
and even those general fund operations may be property tax funded, something in the road department. That's a whole different area. So
Yeah.
I get the point that you're making.
Right.
We've got to be
Judicious, yeah. But that, on your slide number 2, or your very first slide, past the splash sheet, the general fund being behind 7 million kind of puzzles me.
Well, on general fund, the majority of the revenue stream for general fund is your property taxes, and those traditionally come in
Understood.
two
but-
major areas.
But we've gotten a little over half of our revenue in already.
Right.
So 7 million is 70% of what we expect to
Right.
come at the following, but we're still spending.
Yeah. So I did look at what's the revenue that we're projecting on property taxes to potentially, just looking at last year's numbers, and it's about $8 million that will come in.
Right.
On that. That can shrink this deficit, but I also have, 5 more months of spending.
We have a marching army.
Mhm. So on this one, I'm probably going to do a projection because I'm at a good point in the year where I can show you where we're at actually, and then add another column to say anticipated, so that I can kind of forecast where I think we're going to end up surplus or deficit on these funds, particularly in general fund. Road fund's a little harder because their expenditures tend to occur in the latter part of summer and such. So.
Yeah. Well, I would agree with that. You've had enough months. I think it's time.
Yep.
Because we're starting to head into budget anyway. We need
Right.
to start projecting where we're going to be.
Right.
Because I tend to agree with Commissioner Mortensen. I'm not sure we're going to make all that up. Yeah.
Right. Okay, more to come, but if it's all right, I would like to send out a message to all the department heads to let them know and to also ask for their support in trying to conserve resources.
Yeah.
That's all I have.
Okay. Oh, Sean, you've been patient.
Thank you. Kathy, thank you for that listing of the tax revenues. Appreciate that.
Yeah. Okay, we can head into agenda item review. Yeah.
You know, if you didn't have any agenda items, you wouldn't have to be here.
I'll keep that in mind for next week. Sean Rowe, Public Works. Tomorrow we have one agenda item, I believe it's item number 5 for a environmental well removal, abandonment and re-drilling at Tenant Way landfill with Peak Environmental for approximately $76,000. This is related to property acquisition at Tenant Way landfill. So we're moving some of these off of those properties that we will no longer own and put them back onto our own properties. It's a total of abandoning 5 wells and drilling 4 new ones.
The port's paying for all that, right?
We're paying for it, but we'll get it back on our relocation costs once that has been settled with the port. So in short, no, but long, yes.
We're not subsidizing the port for doing their expansion.
We're not, no, that'll be part of the acquisition cost of the property.
And I'm assuming this past all ecology, environmental is all good and well with all this.
Yep, ecology's been a part of this along the way, hand in hand. Came out there on site, took a review of it. They signed off on that. And so from there, we have a third-party consultant as well, working with them.
Just to be clear, it's a little pedantic, but well, you're not talking about relocating the Tenant Way landfill.
No, sir.
So I would have probably said, and well relocation, just to make sure there's no ambiguity. So is it relocating the wells?
Yes, sir.
So how do you put wells in before? You just drill through and?
Yeah, so these are old, some of them are landfill gas probe wells to see if we have migrating gas coming out of the fill. Some of them are actual liquid monitoring wells. So we check if there's anything going with the water off property and monitoring that and things.
So do we do anything with the gas that comes out of the wells?
So these, no gas comes out of these wells. These are just monitoring to make sure that no gas is leaving the landfill itself, that we are collecting it in our other horizontal and vertical wells on the site, and it's going through our flare.
What do we do with the gas we do collect?
The gas at Tenant Way landfill is flared off currently.
At this landfill?
Yes, sir.
So what drives me is 76,000 isn't a lot of money when it comes to how we spend it.
Mm-hmm.
And so that's drilling a few holes essentially.
Yeah, so we'll be drilling 4 new holes and then filling in and abandoning them for 5 holes.
Oh, and you fill them in, it's just like pouring concrete down?
I'm not 100% sure on how they do that.
But along those lines or something like that. Okay. Understood. You know, if you need excavating expertise, there's a gentleman there.
And that's it for our agenda items. If there's any other questions you have.
Looks like we're good, Sean.
You've got, well, was that for him? Oh, just for us.
Yeah, thank you.
Thanks.
Thanks, Sean.
Thanks, Sean.
Appreciate the patience. Sorry about that.
Kathy Funk Baxter, Finance Director. I have one agenda item for tomorrow's meeting. It's the contract to allow us to fund the submission for the Title III federal funding for search and rescue operations for Fire District 3 and 6 combined request, and it's for $12,000. It's on the consent agenda.
That's where they collaborated together instead
They
of competing
collaborated
each other.
together.
That was nice. What about the Atwill group? The one just above that, number 1? What department does that come from? It doesn't really explain what it is. Development Review Services. Anybody know?
Yeah, we don't have tomorrow's agenda item over here.
I don't know.
Also wanted to touch base on headquarters landfill. Last Thursday, we did have a fire about 6 o'clock. It was about 1.5 acres on the active fill zone. Probably, we don't have 100% cause on that, but we expect it was either a battery or a road flare.
Yeah, I saw Mike in town in Castle Rock the other day, and he said maybe one of the lithium batteries or something. He also said guys were having a demonstration. You were looking at some way to do something different with those. Did I understand that right, or maybe not?
So we're looking at a few things. We're looking at normal, regular cameras that can monitor the landfill itself remotely.
Okay.
We're
maybe
also
that's what he
looking,
was talking
yeah, we're looking at possible thermal cameras that can see a little bit deeper into it, that may have a reporting integration built into it, things like that. Yeah, some things that we can get more proactive on this and not have to find it after the fact.
Yeah.
So the fire's always on the surface?
Yeah, it was in the current operating area.
Right. Do we ever have concern about the fire down deep?
Based upon our current gas wells, none of them are indicating anything of that nature. We would see a different gas composition coming out of our horizontal wells at that time.
I was telling Mike, I'd mentioned before, when I was going to college, I worked for the city of Centralia, and they keep me on longer. And one of the duties I had one time, when their landfill had a fire burning underneath, and I was to sit out there with the water truck, and when I saw it flared up, I'd put it out. So you do have those issues out of those things because of all the compressed. And I think they're better about it these days. I mean, we're talking back then in the late 70s, right? So
yeah, and we did keep staff there overnight just to monitor the fill, see if there's any other flare-ups. Nothing else happened at that point in time.
Okay, thank you.
yeah.
Thank you.
You go see it? Public Works. I thought it was Public Works, but I wasn't positive. Sure, they'll be on tomorrow.
I had just raised my hand to comment on Commissioner Weber's question on development review.
Yeah, go
Oh,
ahead.
yes. There we
Sorry,
go.
it took me a minute to get on. So Susan put that through. We actually have 2 development review contracts. I thought this was the second one coming through. I was trying to pull the contract up and wasn't able to. This is to assist Susan in some of the duties that Patrick was performing prior to him leaving. He did a lot of the development review and sign-offs. So because of the construction season, we don't want that to get too far behind. So we wanted to engage in a contract until we get that position filled.
Good.
Okay,
Thanks for
thank
that.
you.
Okay.
And I think we approved one about a month ago, right?
Yeah.
Okay.
I believe.
Super.
Okay. Anything else?
Can we take a break?
We can. Take a, yeah, short recess. Okay.
Sorry, Jessica.
You want to try? Okay,
Okay.
let's go.
A request from Public Works
And
to,
you are?
oh, sorry, Jessica, Human Resources. I have a request from Public Works to start an internal applicant in their accounting specialist 2 opening at step 4. This is something that we workshopped last week.
What, I missed the department again.
Public Works.
Public Works.
You'd like a motion?
Or head nods, yes, no.
Well, we should probably get finance department's approval. Based on our earlier discussion.
It's Public Works. We talked about this last week.
Uh, I'm okay with that.
If you guys are, I wasn't
Yeah.
here, but I certainly trust your judgment, so I'm good with it.
Thank you. And that's the only item I have this morning.
Jessica, Kathy will tell you what we were talking about, why we
Okay.
expressed some reluctance. It begins, right, Kathy?
Okay,
And that's it?
I think that does it.
Hmm.
Any miscellaneous?
I move we take a long break.
Yeah. Okay, we're adjourned. Thank you.